Psychedelics have been introduced in the treatment of psychiatric disorders mainly during the 1960s. At that time, lysergic acid diethylamide, or shortly LSD, was available as medication in pharmacies in some countries and also in their pharmacopoeias. Unfortunately, because of street abuse, LSD was later withdrawn from the market. Recently, however, psychiatrists realized the specific contribution of psychedelics and started using them again, effectively in the treatment. And so there is now a growing evidence indicating that when skillfully blended with psychotherapy, psychedelics can provide an effective and safe treatment for several major psychiatric disorders, including mood disorders. Over 150 clinical investigations of psychedelics have already been carried out. The findings do indicate that psychedelics are a useful therapeutic tool for mood and anxiety disorders, particularly for treatment-resistant depression, and they can also counteract drug dependence. Let me show some of the examples of the experimental studies with psilocybin, LSD, ayahuasca. In difficult-to-treat depressions, the treatment effects of psychedelics have often been prompt and lasting, at times even with just 1 or 2 treatment sessions. Achieving such benefits is undoubtedly new, without a precedent in psychiatry. However, so far most studies worked with relatively small patient groups, and many use open designs without placebo or other comparator. Therefore, more extensive controlled trials are presently undergoing, particularly with psilocybin and ketamine. There are important differences from other psychotropic medications. Most other psychiatric treatments are given to suppress the troublesome symptoms and to reduce the abnormal activity of the brain. The patient's response is then primarily defined by the pharmacological profile of the drug. It can be repeated if a similar dosage of the same medication is given again. But the treatment with psychedelics is quite different. To trigger healing, psychedelics activate the mind, increase connectivity in the brain, and alter the oscillatory process.